to the representatives of the Labasa Hospital, representatives of ANZ, our media partners, the board of visitors, thank you very much for your support. Thank you so much to Saud, you and your team, the Labasa brand staff, for what you have done for Labasa and Savu. We truly appreciate this public-private partnership that Dr. Chauchi talked about, and I'm sure there will be more corporate bodies following, taking cue from you and coming on board to assist us, the Ministry of Health and Medical Services. I also understand that together with your colleagues locally, your ANZ contact office in Auckland has also contributed, and you have donated toys and clothes and books for children as well as the mothers, so we thank you for those kind thoughts. Even though this may seem to be a part of your corporate responsibility, ANZ, we thank you so much for making these developments a reality. Dr. Chauchi did mention the state in which the theatre was, and I haven't seen it, but from what I saw in Savu, I'm sure it's going to be pleasant, a very pleasant sight for us, and of course to the comfort of the staff that will utilize the theatres and the mothers who will feel the comfort of that. So thank you very much. Your passion and commitment I've seen, and I'm sure you will continue with that. And the commitment to give back through your corporate social responsibility truly reflects ANZ's commitment to foster positive changes. Coming back to the population issue, I have been told that there are about 15 deliveries daily. There have been 15 deliveries daily between January to July, and approximately 5 to 6 deliveries recorded on a daily basis for the rest of the year. I'm not sure when we'll reach the million mark, but let's hope we get there someday and one day. So Dr. Chauchi also talked about the developments that have taken place here. Anyways, the refurbishments that you do has certainly given other wards as well as this ward a new lease of life, and of course has been transformed with the environment that complements the great work that the staff does here. We believe that the last renovation, I believe that the last renovation was done 10 years ago, so this was quite timely. And like I said, I'd like to encourage other corporate institutions to follow suit and to be the agents of those change, to be the voice of the change, not only for the betterment of your own organizations, but for the people that you serve and from the people that you make much of your money from. The Fijian government, ladies and gentlemen, cannot achieve these changes on its own. So we'd like to see more collaborative partnerships with our FBOs, our civil society organizations, and we really need to join hands and come on board to provide the much needed support and contributions to the developments of the Fijian health system. I did mention in the morning, there's a lot of criticisms leveled against the health system and the service delivery. Okay, I do understand that we have our own challenges, but we will continue to do, you will continue to do the best that you can do for the service of our people. We will not be able to stop the negativity and the criticisms that are leveled against us, but I would like to urge you to take your work very seriously, because you hold positions that are very important to our people. Hospitals, the service delivery means life and death for our people. So please ensure that there are no negligent practices. That's very important. Do your work with utmost commitment and dedications, and we will achieve good results. And in terms of technology, yes, technological advancements are very important for us to capture real-time data and to see how best we can use that data to move forward. Coming back to the expectations of our people, within the last year or so, I have understood that our people have a lot of expectations, which maybe at times we will not be able to meet. For example, this morning, when we were at the other facility, we managed to talk to some people and ask how would they rate the services. People are very happy. But then there was a comment that, oh, I've been waiting for 10 minutes. I've been waiting for 10 minutes. I believe that's a justified time. Okay? The fact is, a lot of our people are expecting private treatment within public facilities. That is something that we'll have to understand. Our hospitals are public hospitals where almost anyone to everyone comes for service delivery. Unfortunately, a lot has been talked about waiting times. In a public facility, it is normal to wait. Even in private facilities, people go and wait. So like I said, the expectations are sort of, this is what I normally, the expectations have hit the roof now. So that's where your benchmarks are. Okay, that's where your benchmark is, because we are here to serve the people, and we should at all the times we should see whatever we have and we put it to the best use for our people. And I'm sure you're doing that. That's why you are rated number 1, Dr. Chowchi. And once again, I thank your leadership team for that. So yes, we are ready to support you in future initiatives. Of course, you have to remember that we have our budgetary constraints. We will work within our budget. And hopefully your dream does come true if I don't pull you away from here and take you down to the central division, where I think your expertise is needed much. And on that note, ladies and gentlemen, can we put our hands together and give a big thank you to ANZ, Team ANZ, for helping Team Health in assisting us to go where we want to go. I know there's a long way for us to go, but they say the journey of 1,000 miles begins with a single step. So we've just taken that step, the baby steps we've taken, and I'm sure we will reach there one day. And so on that note, thank you very much, and I look forward to seeing the newly refurbished Labour Ward. Ladies and gentlemen, thank you. God bless.